Bonjour,
Hello, my name is Alain Entef. I'm the co-founder of Gifted Mom. I'm an engineer, and then I co-founded this project in 2012, right after my studies. It was kind of a hobby at the beginning, but now I saw that the uh, mortality rate of pregnant women, of course, had increased, so boomed in less than 10 years. So what was the problem? Maybe with all the technologies, why we had, in fact, all this problem? And so this is Monique. She's a mother. It's She had 3 children, and during her fourth pregnancy, she goes to a hospital, and we asked her what was the problem. So she only had one prenatal course in the 9 months of pregnancy, and this is a problem that we've noticed. We have the medical resources, the vaccine. It's for babies between 0 and 9 months. This is free. The CPN, that is to say, the prenatal classes, but some mothers don't follow these prenatal classes. So we've noticed that maybe the problem, despite the fact that we have the resources, is there an awareness campaign to talk about this? So that is why we've developed Gifted Mom in 2013. It's an e-health platform so that we can follow up the pregnancy, and also we have an Android application. So this is the preventative part of that solution. So you have to go to your prenatal class. You have a reminder, and every month they give advice. How do you take care of yourself, your babies? And so all this information is available to mothers. And then there's more of a creative. There's like a toll-free number, 24 hours a day, 7 days a week. You can ask questions. So there's a connection between these mothers and these doctors. So the impact was followed for 3 years. We followed over 10,000 women in Cameroun, over 34 health centers, and among these health centers we have been able to increase the number of women attending not only prenatal classes but also going for their vaccination. So every day we got lots of SMS text messages, and we were able through these messages to detect the women who were in a danger situation. So then we called the doctor. Now these are our partners. We have the pilot phase, the IT partners, you can see them on my screen, and then we also have partnered up with Google. As we said, we are really beneficiaries of these services, and the fact that we have been able to put this in our application. So the project, as I said, started in 2013, and then we're able to collect over $120,000. Then we took part in lots of contests in order to get these funds. We were awarded e-application in Africa, the best application, so Starter-Upper of the Year. The project was supported by Queen Elizabeth, which gave us lots of buzz. We are based in Yaoundé. It's a partnership to work also with other players, so that all the mothers in Africa, as soon as they find out that they're pregnant, they get a text message to say, okay, don't forget your next medical appointment.
Well, you're going to have Beatrice Garrett, who's going to give you an award, even though it's not going to be the
Queen Elizabeth, and I hope that a picture will be taken. So we're also going to ask questions to you in a few minutes from now, but I have 2 or 3 minutes which have just cropped up in my mind. And so the first question is, you know what the difference is between the mothers who use smartphones and those who don't use smartphones? How do you get all the information and the statistical information concerning all these mobile phones holders? Answer. Well, most of the women who use mobile phones use them for text messages, but we also have women who use other apps. But the penetration of smartphones is now growing in Africa, especially when it comes to text messages. That means that we can get into contact with more mothers than we used to. So the text message is still very popular. But this is something which is developing in Africa, but also in our countries. Now, another question I would like to raise. No, you are in contact round the clock with these pregnant women, and you also have other people, doctors, who can answer to their questions. Why do you use text mails or text messages? Why do they rather use text messages when they want to get into contact with a doctor? And why don't they go and consult with a doctor? Do they find it better? Do they find it better or more comfortable? Answer. Well, that's a nice question, because I think that there really is a problem in our countries. We don't have enough doctors for pregnant mothers, and a pregnant mother has to wait several weeks and even more before she can see a doctor. Now, it's not always the case. Sometimes these mothers don't have to go to the hospital. But if they don't have to go to see a doctor at the hospital, well, then it's more difficult for them to get into contact with the medical care providers. And that's why they use so much the text message. And it's easier for them to use these apps. Now, I think there is also the issue of response time, because as soon as the mother has sent a query, well, she gets the reply in less than 10 minutes. And I think that this is another advantage of this system. Well, I think that this is an environment in which we want to get replies very fast. So let's see now, what are the women who use this app? Either the text message. Are we speaking of young women who live in urban areas and who know what a mobile phone is and use it very often? Or are we speaking of other women in rural areas? So can you tell us more about this, the profile of these women? Well, that's another question which I find very interesting. Well, because as soon as you explain to women what it's all about, very often they're very interested. And even in urban areas, you have women like Monique who has not attended these prenatal courses. And therefore, it's not only a urban problem, it's a problem which you can also have in rural areas, of course. But in some urban areas, women don't even use mobile phones. So most women use it when they're in urban areas. But we also have many women in rural areas, and they're younger women. Younger women because it's the first time they're pregnant, and so they're a bit concerned and worried. When women who have had already 2 children, well, may not use the mobile phone as much as younger ones. Now, another question. How can you work with a free service? Because it's not going to be free forever, I imagine. Answer. Well, I think that that's one of the issues we have with e-health, because we have a first pilot step or phase, and it's free. And then we need money. We need financial support. So we've been going through what we call social business process, and we've been working in partnerships with non-governmental organizations. They've been advising us. They've been telling us more about the cost of the system. For my part, I'm working in the northern part of Cameroun, where we find a high mortality rate among young mothers. And in Cameroun, we have a specific plan which is supporting us financially so as to customize this system. And this is how we've been developing this. Now, in the long term, is it going to be a system you're going to have to pay for or not? Well, we're looking into this. We don't know what's going to happen in the future. We started with a green number. So this was in 2014. So we had a mobile call, which was free. Then we had people paying for their text messages, which was not very expensive. It did bring some money, but it wasn't enough. So I think that we really have to find today other ways of increasing our revenues. And 100 to 150 francs, well, this is what it could cost for some users. But apart from the fact that we're also looking for partners, we have developed a specific system which is very innovative. And I think that thanks to the platform we have today, we'll be able to help all these women in rural and urban areas. Well, this brings us back to what we've said at the very onset. The partners in telecommunications are really invaluable partners and stakeholders. Well, thank you very much.